Okay, we're going to continue on with the treatment of CF. Controlling infection is a really important part of treating CF. As we know, there's this constant cycle of inflammation and infection going on, especially in the lungs, which is usually what the major cause of death is. So we want to make sure that we, as much as possible, control the infections that the patients get in the lungs. So we do this by mobilization of secretions to reduce airway obstructions. So working on things to move that heavy, thick mucus out of the lungs, making sure we give any immunizations, another important role that pharmacists play, that make sure they have all their immunizations that can help them avoid infection. And then, of course, antibiotic treatment if they need that. So the first thing we're going to talk about is mobilization of secretions. You can do this with physical therapy, and there's all kinds of different devices that can be used to do this. There's also a drug called Dornase alpha, which I'm going to just spend a minute on. What this drug does is it's specific for the white blood cells that rush into the lungs, thinking there's an infection, and then when they get there and think it's an infection, and they're ineffective because of the mucus and other things, and then they die and they cause more of the problem by clogging the airways. So we want to make sure that we try to decrease that. Now, Dornase alpha is specific for those white cells that die, and we'll chop that up and help that be able to get removed with coughing and other ways of getting rid of the Dornase alpha. And then the final thing is to talk about is hypertonic saline, which is just as it sounds. It's a 7% sodium chloride solution. Remember, normal saline is 0.9%, so this is quite salty compared to normal saline. It's hypertonic, and this is an interesting drug that's basically just salt water. So we'll start with that mobilization. So there's this mechanical way of mobilizing secretions. So if any of you have spent time on a pediatric respiratory ward, you've probably seen patients actually have hand percussion, which is where you beat on the child's back to try to break up the mucus, and any respiratory therapist will know how to do this because this is common in the hospitals and commonly taught to parents and other caregivers of kids with CF and adults with CF, to try to break up that mucus as much as possible so it can be removed with coughing. There's also what's called an OPEP, which is an osculating positive pressure device with a flutter valve. It's also called a flutter, where they blow into this and it, again, provides back pressure, which allows the mucus to be broken, or helps break up the mucus. There's also high frequency chest wall oscillators, which is a vest that the patient puts on, which basically beats on the chest to try to, again, break up the mucus. There's also interpulmonary percussive ventilation. I don't really know what that is exactly. And then there's also some techniques of breathing and huffing that you can teach patients to try to move mucus out of their lungs. So what this brings up is that the cough is very important for moving the mucus out. So you want to be really careful about giving any type of cough suppressant. So any cough suppressant that they're taking needs to be carefully thought about and make sure that they know what they're doing, because the cough is one of the most important things to be able to actually move the mucus out of the lungs. This is a therapy vest I was talking about. So patients will spend like a half hour with this therapy vest on several times a day to try to keep that mucus broken up. This is something we drug around with us everywhere around the world for Isaac to be able to use his therapy vest. And one of the things, if you do have CF patients that are using this, you need to make sure that they can use this in other countries. We spent a lot of time looking for converters in other countries when either they were forgotten or we had the wrong converter or whatever. You have to have the right electrical supply. Albuterol use, is that important? Actually, albuterol in any beta agonist that will open up the airways is helpful, and it is prescribed to actually get medications delivered to the lungs to open up the airways as much as they can, but it doesn't really improve any lung function. But many of the patients also have a reactive airway component to their disease, and albuterol will help with that, but it's also for med delivery. All right, hypertonic saline. This is a super cool drug. Some docs in Australia realized that their patients that surfed, that were surfers, had a better lung function than those that didn't surf. They just noticed that, and they thought, well, I wonder if being in that salt water helps. Because remember, the issue is you don't have enough chloride in that airway surface liquid to pull, and those airways get dehydrated and gunky. So by putting a hypertonic saline into the lungs, by breathing in that hypertonic saline, are you actually able to move water into the airway surface liquid and help with some of that rehydrating of the airway surface liquid? And that's what they found, is that they were able to pull more water into the airway surface liquid and help with getting the mucus to move out. So it improves transportability of the sputum, hydrates the airway surface, and improves mucociliary clearance and lung function. So here's a picture of it. So you can see here a normal CFTR will have this pretty looking mucus, and you have this airway surface liquid. So you can see this is enlarged here. Here's your airway surface liquid that's, green because it's mucus, but here's your transport moving the mucus out, and the cilia that are waving like seaweed in there, pushing. This is our airway surface liquid, moving the mucus out, because this is regulating the sodium and chloride properly, because you have a functioning CFTR. If you have a malfunctioning CFTR, your chloride's not going out properly, then you dehydrate this airway surface liquid. So you look at how there's hardly any air. That's this blue area right here. There's hardly any. See how much blue there is here? And there's hardly any blue here because we've dehydrated that. And now we've got this angry looking nasty mucus layer because of that. If you add the osmotic agent, in this case hypertonic saline, 7% sodium chloride, you are going to put more osmotic pressure here, which is going to pull water. And notice now we have a decent looking airway surface liquid that allows the cilia now to work. See how these sad cilia are here, and now these cilia look nice, and they're pushing the drug or pushing the mucus out again this way. Here there's no movement. The mucus just sits there, and boy, bacteria love this yummy mucus where it can hide and breed and be fed. So if you can move that mucus out, you are helping to avoid infection. There is an increased volume of airway surface liquid. We don't know if the PFTs are improved that much, your pulmonary function tests, but there's significantly fewer pulmonary exacerbations and trend toward an improvement in lung function. Immunizations, we already talked about this. This is a pharmacist's role, right? Pharmacists need to make sure the patients have all their immunizations. All right, I'm going to stop there, and we'll get back with another video and talk about antibiotic therapy. Thanks.